Yes, very fantastic evening, my dear friends. Welcome to MIQ series Pharmacology. By the way, I am Dr. Thiru. My voice audible? My slides visible? Yes, very fantastic evening. Very fantastic evening, my dear friends. Yes, everything good. So, now we are going to discuss the most important MCQs. So, start, the first question ready. A 70-year-old man with the Parkinson disease present for a routine follow-up. He reports improvement in his tremor and bradykinesia, but is concerned about recent development of net-like purple skin rashes in his lower limb, which worsen in cold weather. He denies pain or itching. His medication includes carbidopa, levodopa, pramipexole, and recently added a agent for dyskinesia to control. Which of the following medication is most likely responsible for his skin changes? Answer: yes, fantastic, very fantastic. Answer: amantadine. Yeah, this question how to discuss. See, amantadine actually a antiviral drug useful for influenza A. See, actually, we have 20 question after. In the 20 question, I try to fit whole pharmacology within 1 hour. Definitely, I'm going to be very, very useful in this session. So please use this opportunity. Amantadine, we know a antiviral drug useful for influenza A virus, but the drug has NMDA blocking property and dopaminergic agonism and anticholinergic. Because of having NMDA blocking property, useful in Parkinson disorder to control levodopa induced dyskinesia. So, question: l- amantadine very useful for controlling levodopa induced dyskinesia. But when using amantadine, it causes two important problems. One is ankle edema. One more thing called livido reticularis. Yeah, net like skin rashes. Net like purplish skin rashes, especially in lower limb. It's going to worsen when exposed to cold weather. It's a painless and will be discontinued when they stop the drug. That's about amantadine. But look at the other option: levodopa, prime pixel, salicylic. Levodopa, a pro-drug dopamine. Prime pixel, a non-ergot D2 agonist. Salicylic, a MAO B blocker. Okay. Now, what are the important adverse effects? Look here. Levodopa, a pro-drug, may cross blood-brain barrier, goes to brain. What are the ADR? The peripheral adverse effect of levodopa may cause nausea, vomiting. The most common problem: nausea, vomiting, and alteration of taste sensation. Sometimes they acting on heart, beta 1 causing tachycardia, arrhythmias, angina. Whereas the central adverse effect causes psychosis and chorioathetoid dyskinesia. That's why to control levodopa induced dyskinesia, we are adding mentolin. Look at the option B, pramipexole. Pramipexole, a non-ergot D2 agonist. It causes most commonly psychosis, the most important area, as the dopamine agonist causing psychosis. Here, the most important symptom, they have compulsive behavior, compulsively want to go for shopping, adamantly want to go for shopping. In the shopping, they want to steal some unwanted object for kleptomania, and they have increased interest on sex, excessive sexual desire. All are important adverse effect. In this junction, can you please answer anybody? The prime pexole and use something called rotigotine, ropinol. They, in addition to Parkinson disorder, they also very useful for treatment of what? Restless leg syndrome. Restless leg syndrome. So, question: D2 agonists like pramipexole, proteogliflozin, ropinol, very useful for restless leg syndrome also. Okay, and sertraline, a MAO B blocker causing adverse effect. Mainly central nervous system stimulation causes insomnia and anxiety problem. That finishes first question. Like that, for every question, we're going to cover so many aspects. So listen carefully. My second question. Ready? Find out the false statement. Time starts. Ready? Find out the false statement. Azithromycin associated with the tendon rupture. False, false, false. Look at other option. Ciprofloxacin inhibiting DNA kinase. Yes, true statement. VPNM is resistant to beta-lactamase. Yes, true statement. Linezolid is bacteriostatic. True. So the right answer for the question, option number A. Find out the false statement. Answer A. I just go. Ready? Start answering. Azithromycin, a macrolide antibiotic. They causes mainly GI toxicity. All the macrolide activating motilin receptor in the GIT. So common adverse effect GI toxicity in the form of diarrhea. So macrolide mean mainly diarrhea, especially erythro, powerful motilin activator. And azithromycin may also cause adverse effect of reversible deafness and very important they cause QT prolongation. Macrolide may cause QT prolongation. Can you please answer in the chat box? Come. The tendon ruptures are important adverse effect of which group of drug? Your quinolones. Quinolone causes tendon rupture, sometimes cartilage damage. So, among the quinolone, which are having high risk of causing tendon rupture, P-floxacin, levofloxacin, and ciprofloxacin. Whereas, which are the quinolone having low risk of tendon rupture? Levofloxacin and pacifloxacin. Remember, tendon ruptures are common adverse effect of quinolone, especially in extremes of age. When I give quinolone in less than 6-year-old child, or when I give more than 60-year-old person in extremes age group patient, risk of tendon rupture. Okay. And coming to my second important question, ciprofloxacin. Yes, quinolone acting by what mechanism? You should know. Quinolone acting by inhibiting DNA guys. See, in case of gram negative infection, inhibiting DNA guys. In gram positive infection, inhibiting topoisomerase 4 enzyme. Yes, good. And coming to option C, imipenem resistant to beta lactamase degradation. Yes, true statement. True statement. And linezolid. One second, doctor. Can you please answer? Linezolid. Linezolid. Yeah. Sorry. Imipenem. Imipenem, one of the atypical beta lactam drug, broad spectrum drug, but short acting. Reason for short acting: rapidly undergo destruction by dehydropeptidase enzyme in the kidney. That's why to prolong the duration action, I am going to give cilastatin. MCQ. Cilastatin is the dehydropeptidase 1 enzyme inhibitor, thereby going to prolong the duration action of impinum. Okay. And finally, one super important question. Linezolid bacteriostatic? Yes, bacteriostatic. Remember, all the antibiotic acting by inhibiting protein synthesis or bacteriostatic. Can you give exception? All antibiotic acting by inhibiting protein synthesis or bacteriostatic. Exception: aminoglycoside and streptogramine. These two are bactericidal. All others are static. And linezolid, a wonderful drug useful for MRSA, VRSA, pneumonia, pneumonia, as well as wonderful drug for MDR-TB, MDR-TB, and for this adverse effect, very, very important. Please note, it causes thrombocytopenia, causing bleeding problem, neuropathy, uptake and peripheral neuropathy. Also, this is important. It has MAO enzyme inhibitory property. Risk of cheese reaction. linezolid, a antibiotic having MAO enzyme inhibitory property, risk of cheese reaction, rarely causing lactic acidosis. Okay, all are very important. In one question, I want to give lot of points, so please use the opportunity very well. Okay, good. Now, wait, next question. Look here. Which of following anti-helminthic drug causes neuromuscular blockade leading to spastic paralysis? Anybody? What answer? I'm waiting. Can you please answer? Which is one anti-helminthic inhibiting causing spastic paralysis? The right answer, go for parental palmate. Parental palmate, a anti-helminthic agent, it is causes spastic paralysis because it's going to have NM stimulatory action. They causes depolarization of the NM that is causing muscle spasm, muscle contraction called depolarization muscle blockade. Yes, good, good, good. Yes, good. All are answering D very nicely. Now look at the other option. Albendazole. Albendazole and mebendazole are acting by inhibiting microtubule. Anti-helminthic drug inhibiting microtubules are albendazole and mebendazole. In this junction, you should know anti-cancer drug inhibiting microtubule mean vinca alkaloid and taxanes. Similarly, a drug useful for gout inhibiting microtubules of neutrophil mean think of colchicine. Important. Coming to option B. Ivermectin, a wonderful drug for river blindness, also used for scabies and spondylitis. It is acting by activating glutamate gated chloride channel and causing hyperpolarization muscle, causing flaccid. They cause flaccid paralysis. Okay, parental causing spasm, whereas ivermectin causes flaccid paralysis. And finally, prosequental, it causes calcium influx, causing calcium influx. That finishes important mechanism action based questions on anti-helminthic. Question simple, but somebody may mistake in this area. So please careful, very important topic, anti-helminthic and their mechanism action. Okay, good. Now, coming to fourth question, ready? A patient with schizophrenia present to the emergency department with a high fever, lead pipe rigidity, and elevated CK creatine kinase. Which drug most likely responsible for this problem? Look here. Yes, somebody asking answering C. Okay, okay, come. The right answer, go for option C. Risperidone. Fantastic. Those voting for C. Fantastic. Congrats. Look here. This question, patient is schizophrenia, developed high fever, lead pipe rigidity, that means neuroleptic Malignant syndrome, one type of EPS. So question, patient, a known psychiatric patient, developed EPS, a type called malignant neuroleptic Malignant syndrome. Now, among the given option, a drug causing EPS is risperidone. Look here, all the given drug in these questions are atypical antipsychotic. You know, atypical drugs are primarily blocking 5-HT2. But here, the risperidone, in addition to blocking 5-HT2, it also blocks D2. Thereby, risk of causing EPS and galactoria. So, among the atypical antipsychotic, a drug causing maximum EPS is your risperidone because having D2 blocking property. So, answer C. Now, look at the extra point. When I say this question with malignant neuroleptic syndrome, anybody want answer? For this case, what is the treatment action? For treating the neuroleptic syndrome, what the best answer? The answer is go for dandrolin. Dandrolin, one of the directly acting skeletal muscle action, blocking the ryanodine receptor, inhibiting release of calcium from sarcoplasm. That is the drug of choice. So drug of choice is Dantrolene. Supportively, adjuvantly, I can add bromocriptine, a D2 agonist. So drug of choice Dantrolene. Good, good. Somebody answering very nicely. Fantastic. Good. Now look at the other option. Clozapine, very important. Adverse effect, very important. Remember, clozapine, a wonderful antipsychotic having anti-suicide action. It causes adverse effect of agranulocytosis. 0.81% people on this drug developing this complication, and it is dose independent problem. That's why MCQ, whenever you are giving this drug, advise the patient to undergo complete blood count checkup every week, at least for first 3 months, because they cause dose independent agranulocytosis. Then 10% people may develop seizure and may cause constipation. But recently asked MC question, the drug causes sialorrhea. That means excessive salivation. Because of excess salivation, when they go for bed, they're developing all saliva going to wet pillow called pillow wet syndrome. So name the antipsychotic drug causing sialorrhea, pillow wet syndrome. Think of clozapine, and also causing myocarditis, resulting in chest pain and causing metabolic syndrome, obesity, diabetes, hypercholesterol. Okay, coming to quetiapine, this drug causes cataract problem, priapism, and having high amount of antihistaminic, resulting in sedation, also causing metabolic syndrome. That's what important area. Okay. Now, one super interesting question. Look here. In this junction, you should know. Come on, please answer. Regarding atypical antipsychotic, lot of drug may cause metabolic syndrome, causing obesity, diabetes, and hypercholesterolemia. Anybody? Name the atypical drug causing more risk of metabolic syndrome. Answer, pain. So-called quetiapine, clozapine, olanzapine. Okay. Whereas which are having least risk or no risk of obesity? We are having ziprasidone, aripiprazole, acinapine. Their advantage of having less risk of metabolic syndrome. Again, MCQ, please remember, ziprasidone causes adverse effect of QT prolongation. Old question, please remember, it causes QT prolongation. Okay, and one more question. Acinapine undergo high amount of first pass metabolism. So given usually sublingually. So acinapine due to sublingual because undergo high first pass metabolism. Okay. All are extra point actually. Extra point. Okay. Now question number 5. Once again, are you able to follow me speed doctor? Because time is 7 to 8. In the 1 hour, I have to cover 20 questions. First, tell me, are you able to follow me speed? Come on down. Able to understand? Able to follow? Ready? Now. Yeah. Good, good. Now we start. Question 5. A 60-year-old woman with history of diabetes present with painful vesicular rashes, and the picture given. What answer? Yes, the answer is yes, yes. The answer is yeah, good. It's a shingles called herpes zoster. Answer A, cyclic. Now, I just take 2 minute time for this question. Very important. Sometimes they ask you about non-retroviral drug. Usually we expecting anti-retrovirus. Sometimes asking non-retrovirus. So go one by one. So here's the herpes. For herpes simplex infection, the most commonly used antiviral acyclovir. If not, what are the other antiviral drugs useful for herpes? We can go for Val acyclovir. Val mean prodrug. Prodrug. So prodrug of acyclovir, or we go for docosanol. It's a topically given drug called viral entry inhibitor. And finally, one old question, we have one thing called famciclovir. It's a prodrug. It become active form called 6-deoxypenciclovir. Active form. So these are drugs useful for herpes simplex. In this 2 point, you should know. The point is acyclovir, the most common drug useful for herpes. No, that drug, what mechanism action? Imagine it's herpes virus. Now, what is mechanism action? This is also old question. acyclovir penetrating into virus, and once enter into virus, it get activated by using viral thymidine kinase, and the active form is acyclovir triphosphate. Come on, when they become active form, they're going to inhibit viral DNA synthesis. That is inhibiting viral DNA polymerase enzyme. Here, see question. Acyclovir for its action needs activation. It's activated by help of viral thymidine kinase. So when there is a mutation of this enzyme, my drug will develop resistance due to deficiency of viral thymidine kinase enzyme. That is MCQ. Last question: what is the most important area? Commonly causing GI toxicity, but the most important causes nephrotoxicity. The dose limit toxicity is a nephrotoxicity. Okay. Now, just for completion purpose, other options. Look in influenza. For influenza virus, we using amantadine, rimantadine. These are useful only for A. And we have some drug called oseltamivir, zenamivir, useful for both A and B. B is called bad flu, swine flu. Okay, and amantadine, rimantadine, they are called viral entry inhibitor. Just now discuss amantadine also useful for treatment of levodopa induced dyskinesia. That means useful in Parkinson. So name the antiviral drug useful for treating Parkinson, amantadine. And coming to oseltamivir, useful for A and B. Oh, mnemonic. O mean they call neuraminidase inhibitor. There is viral release blocker. Here MCQ. Oseltamivir, oral drug causes adverse effect of GI toxicity, rarely causing neuropsychiatric problem. Okay, whereas zenamivir, can I please answer? Zenamivir given through which route? Zenamivir given inhalation, causing risk of bronchospasm. Be careful in bronchial asthmatic patient. What's it? For influenza, we can try vaccine, but vaccines are only temporary because of antigen shift and drift. But latest point, we have two new drugs. Paramivir, intravenous drug, useful for both influenza A and B. It is also neuraminidase enzyme blocker. Last one latest is we want to call Balaxavir. Balaxavir oral drug. It is also useful for both influenza A and B, acting by inhibiting DNA synthesis. So, influenza or. Now, just 1 second. For RSV, for respiratory syncytials, we have ribavirin. But extra point. Can you please answer? Name some monoclonal antibody useful for RSV. Come on. Name some MBB. One is palivizumab, old drug. But today you should know the two recently approved drugs are, one is nirsevimab, approved in July 2023. One more latest, clezaruvimab, June 2025. So we have something called monoclonal antibody useful for RSV, palivizumab, nirsevimab, and clezaruvimab. Anyway, ribavirin, an antiviral drug useful for respiratory syncytial infection. And finally, teicovirimab, useful for monkeypox infection, smallpox, orthopox virus. That finishes MCQs on non-retroviral based question. Ready? Now, next question. A 40-year-old man, an antidepressant for major depression. Ready? Person with myoclonus, hyperreflexia, agitation. He was recently started linezolid for an infection. What drug useful for treating this symptom? Can you please answer? If you tell this answer, you are really going to get first 10 rank in NEET PG. I'm damn sure. Ready? Answer. A 40-year-old man on antidepressant therapy developed myoclonus, hyperreflexia, agitation. He was given one antibiotic linezolid. For treating this, what can be useful? Ready? Look at the question. Here, patient is a known depressed patient on antidepressant. In this option, vilazodone, antidepressant called SPA. It is serotonin partial agonist and reuptake inhibitor. Fluoxetine, one of the antidepressant called SSRI, and amitriptyline antidepressant called TCN. These are the antidepressant. Now, patient on anti, either this or this, and developed myoclonus hyperreflex agitation. That means developed serotonin syndrome due to linezolid. Linezolid MAO enzyme inhibitory property. So, when you give linezolid with antidepressant, risk of Serotonin syndrome. For treating the syndrome, I go for cyproheptadine. So, answer for question option C. Look here. Here's a case of drug interaction. When you give SSRI or SPARI or SNRI with the MOVO blocker, risk of Serotonin syndrome. So, here I'm asking what is useful for treating this case. Answer cyproheptadine. Okay. Once again, you should know what is preparatory? It's an antihistamine. Primarily, it's an antihistamine first generation having additionally anticholinergic plus anti-serotonin activity. Because of having anti-serotonin activity, useful for controlling serotonin syndrome. In this junction, one super question I'm going to ask. Anybody? Name any anti-cancer drug having MAO enzyme inhibitory property. Please answer. It is procarbazine. Yeah. Anti-cancer drug having MAO enzyme inhibitory action procarbazine. Remember, yeah, antibiotic having MAO enzyme inhibitory linezolid. Whereas anti-cancer drug having MAO enzyme inhibitory go for procarbazine. Ready? Okay. Now, come on. I'm expecting a lot of charts. Look here. Find out the true statement. Ready? Phenobarbital is the first line drug for treating seizure in neonates. Yes, true statement. Locosamide enhances fast inactivation of no, wrong answer. It is enhancing slow inactivation of sodium channel. Ethosuximide prescribed for antibiotic for absence seizure with myoclonic. Wrong answer. It is only for absence seizure. Cannabidiol useful in Dravet syndrome. Yes, true statement. Oxcarbazepine has less risk of SIADH than carbamazepine. No, false. It has more risk of SIADH. So, true statement answers of one is A and D. That means answer come to D. Okay. So, the answer for the question option number A. Ready? Right. So the answer is option D. I just explained. Phenobarbital, a wonderful anti-epileptic for neonatal seizure. True statement. Look at the option B. Locosamide Locosamide enhances slow inactivation of sodium channel. It is not fast, slow. One more thing, it has one more action. That is, the locosamide can cause inhibition of CRMP. That is, collapsing response mediator protein, thereby inhibiting the optimal growth and inflammation. So, main action, slow inactivation of sodium channel. Another action inhibiting CRMP, collapsing response mediator protein. Okay, look at this. Absence seizure. Ready? Usually for absence seizure, if the child is having only staring, nothing else, only staring. For the primary absence seizure, the drug of choice mean go for ethosuximide, a T type of CCB. Whereas if they are having absence seizure with myoclonic jerk or tonic-clonic, in that case, drug of choices go for sodium valproate. Okay, and finally, what are the other drugs useful for absence seizure? The other drug can be we having lamotrigine, clonazepam, clobazam, and acetazolamide also having anti-epileptic activity can be useful for absence seizure. In this junction, you should know one more thing. Look here. Cannabidiol, very important, very important. It's an anti-epileptic, useful for treatment of Dravet syndrome, Lennox-Gastaut syndrome, as well as tuberous sclerosis complex. Very important expected question. In this junction, can you please answer? For Lennox-Gastaut syndrome, originally, who is the drug of choice? It is valproate. Similarly, when you ask about this, now I'm waiting. Anybody want to answer? Infantile spasm with the tuberous sclerosis mean in this case, who is the drug of choice? Answer? It's vigabatrin. Vigabatrin, a GABA transaminase inhibitor. Choice. In this junction, can you please answer? Only infant spasm without mean for this case, drug choices go for ACTH, adrenocorticotrophic hormone. Like that, each and every point very important. Please listen carefully. Okay. Next question. Ready? Good, good, good. Next. Which of following is the most appropriate antidote for side poisoning? Ready? Options are N-acetyl, hydroxycobalamin, flumazyl, amyl nitrate. My question: what is the most appropriate antidote? Answer: go for B. Hydroxycobalamin. So the best answer go for hydroxycobalamin. Okay. Now I explain. Actually, I'll explain all about all options before the one question. In cyanide poisoning, what is the problem and how to treat? Actually, in our body, each and every cell, come on, each and every cell in our body has one enzyme called cytochrome oxidase enzyme. This enzyme actually involved in cellular respiration and oxygen generation. Now, what is happening in this poisoning? See, cyanide, imagine cyanide. The cyanide is chelating cytochrome oxidase enzyme. Come on. When cytochrome oxidase is chelated, no chance for cellular respiration. Cell go for anaxia and cell death. For this case, the best antidote go for hydroxycobalamin. It's a between intravenous hydroxy. So it's the best because rapid acting, no serious adverse effect. That is the hydroxychloroquine going to combine with the cyanide and form cyanocobalamin that will undergo excretion through kidney. So the super drug of choice for treatment of cyanide poisoning go for hydroxycobalamin. If this option is not there or if the drug is not available, I can try one more thing called, look at this, one more option, look here, one more option, look here. In cyanide poisoning, I told cyanide chelating this enzyme, thereby no chance for cellular respiration. Then you know what is the another way? We can use one thing called amyl nitrites or sodium nitrite. What they do? They converting heme into methemoglobin. Watch me. Whenever there's methemoglobin, the cyanide has more traction towards methemoglobin and from cyan methemoglobin. Okay, thereby this enzyme getting escaped and along with add sodium thiosulfate, they are going to form sodium thiocyanate and undergo renal route of excretion. So, can you please answer? In olden day, for treating this case, we have one thing called cyanide antidote kit. Come on, the kit containing amyl nitrites, sodium nitrite, and sodium thiosulfate. So, cyanide antidote kit containing amyl nitrate, sodium nitrite, and also sodium thiosulfate. Anyway, the best drug of choice for this case is hydroxycobalamin, or we can go for older treatment antidote kit containing amyl nitrate or uh, uh, sodium nitrate and sodium thiosulfate. Okay, in this junction, I just go for rapidly some other action. See, this question dealing with the antidote, no? So rapid fire. Come on, come on, come on, come on. What is the best antidote for benzodiazepine poisoning? Flumazenil. Come on. What is the drug of choice for treatment of morphine, acute morphine poisoning? Intravenous naloxone, IV naloxone. Okay. What is the drug of choice for tricyclic antidepressant? Sodium bicarbonate. They go metabolic acidosis. So best is go for sodium bicarbonate. And then what is the best antidote for methamphetamine? For methyl alcohol, the antidote 5 called 4-methylpyrazole. And last question, very, very, very important for treatment of atropine, the so-called datura, for datura poisoning, the so-called belladonna poisoning. What is the antidote? It is 5-sostigmine. 5-sostigmine, yeah, yeah, choline esterase enzyme inhibitor. That's the best antidote for treatment of atropine toxicity. Very important, very important. Okay. And then for digoxin poisoning, digibine antidote. And for paracetamol, N-acetylcysteine. It's also a mucolytic, very good choice for. It's going to be a glutathione repletion. All are very important, very important. Okay. Next. Which of the following reaction is a phase one? This simple question, but expect a question. Even INCD also question came. So, which of the following reaction called phase one metabolic reaction among this option? Gluconidation, sulfation, hydroxylation, acylation. Answer hydroxylation. Remember, when you say drug metabolism, we have phase one and phase two. The phase one reactions are oxidation, reduction, hydrolysis, cyclization, and decyclization. So, hydroxylation is a phase one. Remember, all the phase one reaction happening in the liver by one group of enzyme called microsomal enzyme, CYP455 enzyme. The most of drug undergo phase 1 mainly by oxidation. The most common phase 1 reaction, oxidation reaction. Remaining and all phase 2 reaction. Very simple but important. Now, ready? Which of the MAB binding to vascular growth factor receptor inhibiting angiogenesis useful in cancer? Ready? I am asking VGF blocker. Answer? Very simple. Bevacizumab. Look at this. C I mean circulation. Circulation. C I mean circulation. In the circulation inhibiting vascular growth factor. Answer bevacizumab. And look at the other option. Trastuzumab, cetuximab, rituximab. The cetuximab inhibiting EGFR, epidermal growth factor receptor, useful for colonic cancer. Here, this and this are very important. Please watch. Trastuzumab, one of the MAB, one more drug called pertuzumab, targeting against HER2 on the breast. So, useful for treatment of breast cancer. Target important. Trastuzumab, pertuzumab, targeting against HER2, useful for HER2 positive breast cancer. The most important area they causes cardiotoxicity. Cardiotoxicity. Okay. And coming to next, bevacizumab. C I mean circulation in the blood, acting against VGFR, vascular growth factor receptor, inhibiting angiogenesis, inhibiting vascular supply, useful for colonic cancer, even for RCC, also useful for diabetic retinopathy. And remember, most of the VGFR blocker may cause adverse effect of hypertension. VGFR blocker may cause adverse effect of hypertension. And finally, look at rituximab, very, very special man, repeated so many times. Rituximab target important, targeting against CD20 on the B cell. Useful for so many things. For example, useful for CLL, hemolytic anemia, immune thrombocytopenia purpura, non-Hodgkin lymphoma, and arthritis, rheumatoid arthritis. And it's given IV. So ADR causes infusion reaction. One more point, PML. Anybody? What is PML? PML mean progressive multifocal leukoencephalopathy. Rituximab danger drug causing PML. They call progressive multifocal leukoencephalopathy. Okay. Now, which agent causes maximum risk of hand-foot syndrome? Straight question, simple concept. Which causing hand-foot syndrome maximally? So look here. All the given option in this case causing hand-foot syndrome in this maximally capecitabine. See, hand-foot syndrome in ulcer in the hand and the foot. Capecitabine actually a prodrug. A prodrug of 5-fluorouracil causes maximum risk of hand-foot syndrome. Among all anti-cancer drug, a drug causing maximum hand-foot syndrome, capecitabine. Okay, but in this junction, you should know what are the other drugs. What are the other drug causing hand-foot syndrome? The other drugs causing hand-foot syndrome, mainly capecitabine. Other drugs are 5-fluorouracil, doxorubicin, interleukin 2 and pemetrexed. They also causing hand-foot syndrome. Okay, right. Next, coming to 5FU and this one very special 5-fluorouracil, a pyrimidine anti-metabolites. It causes adverse effect of myelosuppression. Very important. It causes vasospasm, risk of hypertension, MI, sometimes stroke, mean acute coronary syndrome, and this also causing hand-foot syndrome. Okay, but maximally capecitabine. And coming to last one thing, your gemcitabine. Anybody? Gemcitabine, a wonderful drug useful for pancreatic cancer. Anybody? Gemcitabine, what is the most important area? Causing myelosuppression and potent radiosensitizer. Important. That's why Goodman Gilman says gemcitabine should not be combined with radiotherapy. It causes potent radiation toxicity. It is radiosensitizer. And finally, one thing. Which of following drug approved for chronic immune thrombocytopenic syndrome? Immune thrombocytopenia purpura refractory to first line. I'm waiting. Can you please answer? Which of following useful for refractory cases of immune thrombocytopenia purpura? Options are fostamatinib, opervikin, abziximab, and eltrombek. What answer? Anybody want answer? The right answer, go for option A, fostamatinib. It's actually a tyrosine kinase enzyme blocker approved for treatment of refractory cases of ITP. Whereas, look at the other option. See, all are done mistake. Now get right answer. Look at opervikin is an interleukin 11 analog. Is useful for treatment of anti-cancer drug-induced thrombocytopenia. It's IL-11 analog. Abziximab, a antiplatelet targeting against glycoprotein 2b3A receptor. Eltrombek is a thrombopoietin receptor stimulant. Okay, so now I go for option A, fostamatinib. If you study Harrison book, one thing called ITP, immune thrombocytopenia purpura. For this, remember the first line treatment is steroid like prednisolone or dexamethasone steroids, or else we can try intravenous immunoglobulin or anti-D. Okay, that is first thing. And for treatment of thrombocytopenia, we can try something called thrombopoietin growth factor like romiplastim, L-thrombobac, latest one called avatrombobac, all are thrombopoietic fracture. Or we can say go for rituximab. But my question, refractory cases. First line drug failed. Refractory case. For refractory case, I go for fostamatinib. It is MCQ. This actually 2 to 3 years back came in Ames paper. That's why I prepared a question. I think most expected question. You should know what are the drugs useful for treatment of ITP. First choice will be steroid. Next we can try thrombopoietin like L-thrombobac or romiplastim. Last option can be fostamatinib. Anyway, you should know opervikin IL-11 useful for treatment of anti-cancer drug-induced thrombocytopenia. Okay, right. Now question starts. Which of following are useful for rheumatoid arthritis acting by inhibiting dihydroorate deadenase? Very simple question. Please answer. This is Leflunomide. Leflunomide, one of the disease-modifying anti-rheumatoid drug acting by inhibiting dihydroorate deadenase. Methotrexate actually having anti-cancer property as well as useful for rheumatoid. In anti-cancer inhibiting dihydrofolate reductase in rheumatoid arthritis activating adenosine pathway. Activating adenosine pathway. Azathioprine is an immunosuppressant, purine, anti, vitamins, hydroxychloroquine, hydroquine are useful for DMRD, useful for DMOD, but the drug inhibiting dihydroorate is leflunomide. Okay, now question starts. Which of following drug targeting alpha 4 beta 7 integrin and useful in the treatment of Crohn's disease? Super question. Who is going to answer? Name the alpha 4 beta 7 integrin blocker useful in the treatment of Crohn's. Options are apripigen, vedolizumab. Answer? The right answer go for vedolizumab. Actually, for treatment of Crohn's disease, we have some new drug. One is called integrin antagonist, where two drugs are there. One is alpha 4 beta 1 blocker called natalizumab. Whereas my question, vedolizumab, it's a alpha 4 beta 7 integrin antagonist. So vedolizumab alpha 4 beta 7, whereas natalizumab alpha 4 beta 1. Once again, after the natalizumab causing adverse effect of PML, so we don't prefer this. Remember, rituximab and natalizumab are antibody having risk of causing PML. Okay, and can you go through other option? For example, preparation. What is it's NK neurokinin 1 antagonist useful for treatment of late phase vomiting due to anti-cancer. See, normally for treatment of vomiting due to anti-cancer, we go for ondansetron or pernocetron 5-HT3 blocker. Whereas for late phase vomiting, we can go for neurokinin 1 blocker like apripigen or fast apripigen. And then ustekinumab, it's a kinin interleukin 12 and 23 blocker useful for treatment of inflammatory bowel disorder. So, right answer for question option B. Now, question 15. Ready? What are the primary targets of inclisiran, a novel lipid-lowering drug? Inclisiran. Anybody? Inclisiran inhibiting synthesis of PCSK9. So answer D. Okay, very good, very good. Look here. Can you please try other option? Name the drug useful for lowering lipid inhibiting citrate lyase pemvidinic acid. Pemvidinic acid, a cholesterol lowering drug acting by inhibiting ATP citrate lyase enzyme. And Niemann-Pick C1L1 transporter blocker, we have one drug called SCTB. It is inhibiting Niemann-Pick C1L1, thereby inhibiting absorption of cholesterol from the diets. Since inhibiting absorption causing adverse effect of steatorrhea, is the most important area. And name the drug called microsomal triglyceride transport blocker. It is lometapide. Microsomal triglyceride transport blocker, lometapide. Okay. Now question start. Inclisiran, so PCSK9 synthesis blocker. It's inhibiting cis RNA. Now one super question. Please watch. You know statins are a wonderful drug lowering lipid by inhibiting HMG co-reactase. And statin causing upregulation of LDL receptor on the liver cells. Look here. This LDL receptor undergo degradation by PCSK9. Now question starts. Anybody want answer? Name some drug that are going to inhibit PC, that is proprotein convertase subclism. Name some antibody. Name some MAB inhibiting PCSK, thereby lowering LDL. They call alirocumab and evolocumab. So question, PCSK9 blocker main go for alirocumab, evolocumab. MAB given injection subcutaneously useful for lowering LDL. Whereas our question, name the drug inhibiting synthesis of PCSK. That's called inclisiran. It's inhibiting. It inhibiting cis RNA. Inhibit cis RNA, thereby inhibiting synthesis of PCSK. This difference you should know. Okay, next. A patient with heart failure with a reduced ejection fraction on full dose of RNA and continuously have high resting heart rate, which of following drug reduces heart rate without affecting contractibility or BP? Any patient having heart failure with a reduced ejection fraction on RNA, full dose RNA. Even then, they developing increased heart rate. I want drug reducing only heart rate with disturbing contraction or BP. Answer? Yes, good answer B. Evaporating. Yes, it's going to cause only bradycardia. They don't interfere force or contraction. Very fantastic, man. Super. Okay. Now look here. What is RNA? RNA mean fixed dose combination of angiotensin receptor plus neprilysin inhibitor. You know, sacubitril, one of the neprilysin inhibitor. It is ARB. So, a fixed dose combination of valsartan plus sacubitril RNA. Very good drug for heart failure. Here you should know, in heart failure, the common drug using acetylcholine ARB, beta blocker, spironolactone, and Webadine. My question, name the drug useful in heart failure, reducing only heart rate mean go for Evaporating. Whereas beta blocker, for example, we have something called carvedilol, bisoprolol, metoprolol succinate, and nivolol. All are useful for heart failure, but they decreasing heart rate plus contraction also. They have negative chronotrophic, negative inotrophic. My question, name the drug decreasing only heart rate mean go for evaporating. Remember, evaporating, a funny current sodium blocker, useful for angina and heart failure. Question to all people. Come on. Evaporating causing what adverse effect? Anybody? One problem causing bradycardia, but you should tell other than bradycardia, what is the one more thing? It causes luminous effect. That is brightness, sudden brightness in the field of vision. Called brightness, called luminous effects. Okay. Now coming to next question. Okay. Which of following directly useful to reduce pseudotumor cerebri, that is idiopathic intracranial hypertension? Answer? Acetazolamide, amiloride, mannitol, furosemide. What answer? The best answer go for acetazolamide. Carbonic anhydrase enzyme blocker. They decreases CSF production, thereby controlling ICT, idiopathic intracranial tension. Now I just go one by one, doctor, one by one. Interesting question. Look here. Acetazolamide, carbonic anhydrase enzyme blocker has lot and lot of use. For example, it's a very good drug for mountain sickness and wonderful drug. Our question: they reduces CSO production, thereby useful for intracellular tension, and yes, anti-epileptic property useful for treatment of epilepsy like absence seizure and for catamenial. When you say catamenial, I mean periodically in female, periodically during menses time alone fits it. Called menstrual seizure. Every month, periodically at the time of menses alone fits. For that we can try, and also useful for periodic paralysis, and very important, it causes loss of bicarbonate through urine, causing urine alkalization. That property useful for treatment of acidic drug poisoning. Name the diuretic useful for making urine alkalization. Answer acetazolamide. One more point. Somebody mentioned good. Useful for glaucoma. It is useful for glaucoma because decreases aqueous humor production. In this junction, can you please answer? Anybody? Acetazolamide useful orally for treatment of glaucoma. But my question: name the two eye drops. Name the two eye drops carbonic anhydrase enzyme inhibitors. We have something called dorzolamide, dorzolamide, and one more drug called brinzolamide. Both are topical eye drops carbonic anhydrase enzyme blocker. Okay, and option A over. Coming to option B, amyloride, a ENaC blocker, ENaC blocker, potassium sparing diuretic. Since potassium sparing can be combined with the loop or thiazide to compensate hypokalemia, but a very special point. Since it's an epithelial sodium blocker, it's mainly useful for treatment of congenital overactive neck problem called Rett syndrome. One more thing, wonderful drug for treatment of cystic fibrosis to improve mucosal secretion. In this junction, I want yes, good, somebody good, good, yes, yes, fantastic. It's very good drug of choice for treatment of lithium induced diabetes insipidus also. Very good, very good, very good. Okay. And finally, what about mannitol? Come on. Mannitol, osmotic diuretic, useful for treatment of glaucoma, intravenous. Name the one and only IV drug for glaucoma, mannitol, useful for trauma-induced edema or ischemic stroke-induced edema, useful edema for acute case for stroke, ischemic stroke, or traumatic edema, are useful for controlling cisplatin toxicity. Cisplatin, an anti-cancer drug causing nephrotoxicity. To control this toxicity, I can combine this with mannitol. In this junction, one super question, can you please answer? Originally, anybody? Originally, who is the antidote for cisplatin? Anybody? It is amifastine. Amifastine is the antidote for cisplatin. That's also important. And mannitol also useful for managing dialysis disequilibrium induced cerebral edema. Okay, that's mannitol. Whereas furosemide, wonderful loop diuretic, useful for LVF and for kidney failure, useful for treatment of kidney failure, to promote urination, useful for relieving symptoms of breathlessness in acute heart failure. Okay, coming to question number 18. Ready? Regarding renalisine, all of the following are true except regarding renalisine, all are true except. Ready? A fantastic question. Who is going to answer? The answer? It reduces fatty acid oxidation. Yes, true statement. It has weak beta blocking property. Yes, true statement. It has late sodium blocking. True statement. Producing QT prolongation with the serine dorsal D. Wrong. It produces QT prolongation but no dorsal D binders. Okay. So answer D. Just take 1 second time. When I say renalisine, what are the points you should know? Look at the option A. Actually, super fine. Look here. Actually, our myocardium normally for you and for me, normally myocardium using fatty acid as a fuel. But in this fatty acid, actually they become undergo oxidation and going to form energy. So normally for you and for me, our fatty acid used for cardiac energy. So heart is using fatty acid. How? They undergo oxidation and produce ATP. For this process to occur, the heart need high amount of oxygen. So normally we have good oxygen is done. Whereas in case of angina, come on, in angina, there is no proper cardiac oxygen supply. So this will not be happening. So heart is struggling a lot. to get energy, struggling. So in that case, I'm going to use one drug called trimetacerine or ranelazine. What they do, they diverting this into glucose. They diverting into glucose oxidation. Look at what the trimetacerine naloxone diverting towards glucose oxidation. They blocking the fatty acid and diverting to this thereby they call fat pathway of fatty acid oxidation inhibitors. So my adolescent and trimetacerine diverting the heart to use glucose oxidation to get energy. This is happening not with the trimetacerine and adolescent. Now, question number two. Look at this. Adolescent also has extra point. It also has late sodium blocking property. Point three. Reduces intracellular calcium load, thereby reducing oxygen demand. Last, it has mild beta blocking property. Also, one more advantage has good glycemic control, safe in diabetes also. Only thing causing adverse effect of QT prolongation. Only prolongation. No Darcy dividers. So in our question, right answer, adolescent causing QT prolongation, but no significant Darcy dividers. That's the answer. Okay. Now, coming to our last question. Adolescent undergo excretion to the kidney, so unsafe in kidney failure patient. Okay, right. Now, nearing the end, can you please answer? A 56-year-old diabetic patient with a New York Heart Association Class 3 heart failure started on new oral anti-diabetic medicine. 2 weeks later, he presented with weight gain and worsening of peripheral edema. Which of following medication most likely responsible for this event? Anybody? One answer. Yes, good answer. C. Very good. I'll get this one. One of the PPAR gamma agonist useful for diabetes, causing adverse effect of fluid retention, causing weight gain, also causing macular edema, may on chronic therapy causing heart failure. Extra point important. Pioglitazone may cause osteoporosis. Be careful in post-menopausal female and rarely causing bladder cancer. All are important. So in this question, a drug causing fluid retention, weight gain mean think of pioglitazone. Look at the other option. Dapagliflozin, one of the sodium glucose transporter 2 blocker. They cause adverse effect of mainly urinary tract infection, also causing hypotension, weight loss, rarely causing ketoacidosis and external genitalia ulcer, gangrene, called 4 years gangrene. But the most common area they cause urinary tract infection, especially fungal infections are very important. And glimepiride, one of the sulfonylurea, they are insulin secretagogue, causing adverse effect of hypoglycemia and also causing weight gain. And finally, sitagliptin, gliptins causing adverse effect of respiratory tract infection like laryngitis, pharyngitis, sinusitis, and rarely causing allergy, Steven Johnson. And one more point, rarely they cause heart failure. Anybody? Name the gliptin. Name the DPP4 blocker has risk of causing heart failure. It is saxagliptin. Saxagliptin. In this junction, you should know one point. Anti-diabetic drug causing heart failure, anti-diabetic useful for treating heart failure. These two are very important. Can you please answer? Name some anti-diabetic useful for treating heart failure. Wonderful question. Please go and answer. Name some anti-diabetic drug approved for treating heart failure. We have something called sodium glucose transporter 2 blocker like dapagliflozin, empagliflozin, and sota. So DAPA, EMPA, and sotagliflozin are SGLT2 blocker approved for treatment of heart failure? Such an important question. And can you please answer? Name some antidiabetic causing heart failure. That is your pioglitazone causing heart failure, saxaglutine causing heart failure. Already rosiglitazone was withdrawn because of causing heart failure. So among the available drug, pioglitazone, a PPR gamma causing heart failure, saxaglutine, a DPP4 blocker causing heart failure. So this type of question is very important, very important. Okay. And finally, the last question I'm going to discuss. Look at it. You have 60-year-old man. Ready? You have 68-year-old man. 3 days post TURP, transurethral prostate resection, reports low abdomen fullness and inability to void urine, is stable and has a distended bladder. Post void urine receives 550 ml. Neurology exam is normal. Resolution drains clear urine. What is the cholinergic agent most appropriate for this case? Come on. In case of post-operative urinary retention. For treating this case, what is the best answer? Yes, good. Yes, good. Answer bethanacol. Very good. Bethanacol, a cholinergic drug. It's an M3 agonist acting on the bladder, going to promote is useful to promote urination. So, bethanacol useful for treatment of post-op paralytic ileus and post-op urine retention. Physostigmine, you know already, it's a drug of choice for atropine poisoning. Carbachol acting all muscarinic and nicotinic leaves. Donepezil, a choline esterase enzyme inhibitor, useful for treatment of Alzheimer's disease. Okay, I just take 1 second time. Please watch. This is very interesting question. Look here. Drug acting on bladder. Very important. Just listen. When you say drug acting on bladder, can you please answer one by one? Come on. Just to discuss. Name the M3 agonist acting on the bladder going to cause promoting urination. Answer bethanacol. The bethanacol, a cholinergic drug acting on M3 promoting urination, useful for treatment of post-operative urinary retention. Okay, good. Now, anybody name the beta 3 agonist acting on bladder causes detrusor relaxation, causing urine retention, thereby useful for treatment of OAB. They call mirabegron. One more drug called Begron, mirabegron and Begron. Both are beta 3 agonists useful for treatment of overactive bladder, useful OAB. Okay. And next question, super interesting question. Anybody? Name one SNRI. That is serotonin norepinephrine reuptake inhibitor. Name one antidepressant acting on bladder, controlling stress incontinence. One recall duloxetine. It's going to increases urethral tone, thereby making urethral strong, thereby useful for controlling stress incontinence urine, useful for stress incontinence. And finally, name the alpha 1 blocker acting on internal urethral sphincter. They're called tamsulosin. Very good drug for treatment of BPH, for treatment of symptoms of benign prostatic hypertrophy. So, tamsulosin, a alpha 1 blocker, useful in elderly male with benign prostatic hypertrophy. In this junction, one super question goes to all people. Anybody? Name one tricyclic antidepressant blocking muscarinic, thereby useful in children with the nocturnal elusis. You want to recall imiperamine, yeah, tricyclic antidepressant has highest anticholinergic property, thereby control urination, useful for treatment of nocturnal enuresis in children. Okay, that's also important. And finally, donepezil useful for Alzheimer. Can you please answer? Name some transdermal patch useful for treating Alzheimer. We have one thing called rivastigmine. Recently, we have donepezil patch also there. Both are cholinesterase inhibitor, enhancing acetylcholine level in the brain. So, donepezil and rivastigmine are anticholinesterase useful for treatment of Alzheimer. In this junction, can you please answer? Name one. Name one NMDA blocker useful for treating Alzheimer. Come on, last question. Name one NMDA blocker useful for treatment Alzheimer. We have one thing called memantine. Memantine, a NMDA blocker useful for treatment of moderate to severe Alzheimer. Useful for moderate to severe Alzheimer called memantine NMDA blocker. Okay, so I think all the 20 questions within 1 hour, man, I covered so many aspects of all the 20 questions. Okay, and one more kind request. Sir, I want to restrict only 20, but some questions, important questions, go and read. Anticoagulant, the warfarin, new anticoagulant, and the antidote. Please refer. That's also very important area of MCQ. So, blood chapter, please read it. Okay. So, I think all the most important questions I covered within the given time. So, you also answering very nicely. So, thank you for your kind cooperation. All the very best for your bright future. May God bless you when the NEET up you are going to appear, you're going to get a very good seat. Definitely bright future waiting for you. All the very best. Okay, may God bless you. Thank you. Thank you, Rich. So far, everything useful. Can you please put your feedback? So far, everything very useful. Thank you, man. Thank you for your kind feedback. Very good. Very good. Okay, so yeah, thank you, man. Thank you all. Very best, man. Good. Why not? Somebody asking glimepiride. Glimepiride causing weight loss, but actually the fluid retention, weight gain, and macular edema are typical of pancreatism. But glimepiride also, but they don't cause heart failure. So anti-diabetic causing weight gain and heart failure mean think of pancreatism, not the glimepiride. Yes, somebody has good doubt. 90 question. Good. Glimepiride not causing heart failure, just causing weight gain. That's all. Whereas pancreatism causing heart failure and weight gain. Goodman says pancreatisone contraindicated in moderate to severe heart failure. That's why. Okay. Yeah. Thank you, man. Thank you. So I'll try to update some new drugs in my Telegram channel. Well, time is problem. I will try to update. Okay. Thank you. All the very best. Thank you. Shall I finish? Yes. Thank you.